Okay, there we go. Welcome everyone to our webinar, 2024 Regional Engagement Session Recap on serving children with complex needs. This webinar is being done in collaboration with the Department of Human Services, Disability Services Division, and Behavioral Health Divisions. Thank you so much for joining us today. My name is Ashley Solzrud Beckman, and I am in the Department of Children, Youth, and Families. I'm a Child Foster Care Wellbeing Program Representative.
And I am Liz Bosnick. I work in the same area as Ashley in the Department of Children, Youth, and Families. I have sort of two roles. I'm in the QRTP operation team and also a Child Foster Care Program Representative.
And also with us today, helping us in the background, is Cassie Tulp and Kerwin McKay from the Disability Services Division. They are regional resource specialists and have been amazing partners with us in doing all of this work. So thank you for being here. And also our coworker, Alicia Wolfman, who is in our permanency area. And she has been part of our team and worked with us all through these regional engagement sessions, and then now in our recap for you today. So thank you all for being here and helping us. As I mentioned before, your cameras are disabled and your microphones are disabled. And if you have any questions throughout the webinar, please put those into the Q&A. We will Kerwin, Cassie, and Alicia are going to be monitoring the Q&A, and Liz and I will be answering questions as we are able to throughout the webinar. This webinar is going to be recorded and be posted on our website in the same place where you registered for this webinar. Also, we will be posting the slide deck when we post that recording. So you will have access to all of that when we post it. So today we are giving you an overview of the information that we got out of our engagement sessions that we held last fall. Our engagement session idea grew out of work that we were doing with county and tribal case managers in conjunction with our partners in disability services and behavioral health at DHS. The direct collaboration that we were doing with them to manage situations where case managers were seeking assistance in serving children with complex needs came about around COVID, when the issue with children boarding in hospitals due to being unable to access appropriate services was coming to a critical head. Across the state agencies, all of us realized that we were all being contacted by the same case managers and about the same children because their needs were crossing all of our service areas. We realized that we needed to collaborate together in order to provide the best technical assistance efficiently, quicker, and be able to get case managers hooked up with services and supports in a more streamlined fashion. This work continues today with the newly developed complex transitions team in the Department of Human Services, and also throughout all of our departments when we individually get contacted in our service areas. And we realize that the case managers could benefit from information that comes from our different areas. So the purpose of our engagement sessions, after working through this with our partners for several years, was that we really wanted to better understand what case managers were experiencing when they're working with children with complex needs. Oftentimes, when a child is at a point, when case managers are contacting us, the child is already at a point of crisis, and it's extremely challenging for case managers to get the right services in place at the right time in order to help avert the crisis or decrease the crisis or get them out of that situation. So by sharing this information that you guys provided to us, we're hoping that you will be able to recognize when a child might have complex needs that might end up rising to the need of crisis and be able to get preventative services in place to prevent that crisis in the first place. So, what are complex needs when we're talking about this? So, first to level set. When we were started doing this work, we immediately noticed some common factors that were across the board the same for a lot for children that we felt that fell into this category that we were identifying as complex needs. They're often involved in multiple systems. They have multiple service needs. There's complicating personal factors that they're experiencing. And throughout all of this, particularly at the point when case managers are reaching out to us, there are pretty significant behavioral challenges that is making their home life unstable, or if they're in a foster care placement already, making that placement unstable, or making it very difficult or impossible to access services due to those behavioral challenges. So when we started working with case managers, we were seeing trends in both the barriers they were experiencing in getting these services to families and also successful strategies. One of the biggest successful strategies that we noted was when case managers were able to collaborate with each other, working through systems barriers. And Liz is going to talk a lot more about that later on in our presentation. So our engagement sessions, as I mentioned before, occurred last fall, and it was from October through December of 2024. The engagement sessions were split into 6 different regions across the state. And when we were doing advertising for people to come to the sessions, we reached out to child welfare and child protection staff, child foster care licensors, disability and waiver service case managers, children's mental health case managers, contracted case managers, and tribes. We wanted to really reach the breadth of folks, professionals who are working with children that would fall into that category of complex needs. And so we used our various channels through Department of Children, Youth, and Families, and then our partners in Disability Services Division and Behavioral Health Division to reach out to folks to get people to come to the sessions. We primarily used Mentimeter in order to do the engagement. Mentimeter is a online engagement platform. And one of the wonderful things about it that we got a lot of positive feedback on was that it was anonymous. So we were able to get all of the information that folks gave us, but it didn't tie it to a person's name. So I feel like we got pretty honest feedback from case managers about barriers and also successful strategies that they were experiencing in working with children with complex needs, and case managers seem to really appreciate utilizing that. The other benefit of it was that it gave us all of the information, it recorded all of the information. So everything that we're presenting to you here today is from that recorded information that people typed into the system to give to us. There were a variety of different questions that we used when we were asking folks about their experiences. We used polls, we used open-ended questions so people could just type in a response, word clouds, which you're going to see a couple of our favorite ones later in our presentation today, and then also multiple choice.
Ashley, before I switch the slides here, I just wanted to say we did see that someone had raised their hand. We don't have a way to call on you and unmute, so please put your question or comment in the Q&A, and then we will either address that for you through the Q&A, or verbally a little bit later here in the presentation.
Thank you, Liz. So our engagement sessions content focus was, as I said before, it was understanding the case manager's landscape of experiences when serving children with complex needs. So we first looked at factors of complex needs. What are some indicators, which we went over a little bit earlier now on what some indicators are. Some behavior levels. What types of behaviors are people seeing at different levels of need when a child has needs in multiple service areas? Their impact to family and home life. Specifically, how is it affecting their relationships? How is it affecting their access to school? We also looked at case management experiences, specifically what they were doing in case planning and crisis planning, how they were accessing services and what type of services they were accessing, what types of crisis intervention services they were accessing, and what types of barriers they were experiencing across all of those fronts. And then throughout the entire engagement session, we really focused a lot on how were case managers handling collaboration, both with the family and then with others. When a child is involved in multiple systems, that means that they often have multiple case managers. So how is a waiver case manager able to collaborate with a children's mental health case manager or a child protection case manager? So here's the stats for who attended our engagement sessions. We had 389 participants total. We did ask for folks in one of our first questions in the sessions was how would they identify, what service area would they identify themselves in? And we had a lot of folks that responded with no response or other. So as a result of that, it was really difficult for us to actually break down responses based on case management type. But you can see we had very good, I would say, attendance through these sessions. And yeah, we're really happy with that. The next question that we had asked folks was, do you have children with complex needs on your caseload? And as you can see, 92% of engagement session participants responded with yes. So what this tells us is that we really hit our target audience here when we're trying to understand what folks are experiencing when they're working with children with complex needs. Next slide, please. Okay, so as I mentioned earlier, we went through and wanted to figure out what sorts of characteristics folks were seeing with children on their caseload at different behavior or levels of need. Next slide, please.
Ashley, as I move on, I'm just going to say again, we've had a couple folks raise their hands. There's not a way for us to have you come off mute. So please lower your hand and put your questions or comments in the Q&A, and we'll get those addressed either verbally later on in the presentation or through the Q&A function.
Thank you. This flowchart was put together by our colleagues in the Disability Services Division back in 2020, and they put it together as a tool for them to use in response to ongoing technical assistance they were providing to counties and tribes who were looking for services and supports for children who would fall into this complex needs category. So we found these levels to be very helpful in describing what to look or listen for when making recommendations for types of services. And then we use this flow chart during our engagement sessions to understand better the types of behaviors, specific behaviors that case managers were seeing at these varying levels of need, and how case managers shifted their work to access services and supports for them at these different levels. So now we are going to be going through the information that engagement session participants provided directly to us on the behaviors that they observed at each level of need: emerging, significant, and urgent or crisis level. A little later on, Liz is going to share information on how case management activities, barriers, and solutions they used when working to access services and supports for children in need in these different levels. So first, we're going to start out with a recreation of this of the flow chart that our colleagues in disability services put together. So after collecting all of the information that participants provided to us, we were able to put all of the different types of behaviors into categories. And then once they were in categories, we were able to identify which behaviors occurred more frequently at each behavior level. So as you can see, there are some commonalities across each of the levels of need. And in the next slides, I will go through some of the subcategories in these broader categories, and then some specific examples of behaviors that case managers shared with us. I'll also provide, as I mentioned before, specific information on school or home life impacts that the children experience at these levels. And as we go through each level, I'm going to provide an explanation of the new categories rather than rehashing the old ones or the ones that were in the previous level. So for emerging needs, the common characteristics that we saw here that participants reported to us were primarily significantly disruptive mental health or developmental disability symptoms, violence and severe aggression, academic or school challenges, and then relationship challenges. And you can see the subcategories that were identified under each of those. Next slide, please. So this is under our significant symptoms. So emotional dysregulation. These were very common things that case managers repeatedly said over and over: lashing out, meltdowns, defiance, acting out, fighting, avoidance behaviors, withdrawal from recent activities, refusing services and programming, school refusal, refusing medication, and social isolation. Then some more examples, and this was under the violence or severe aggression. And also on the other side, it is academic or school challenges. We have threats of harm and physical assault, truancy, and then disruptive behavior at school. One of the things that I will note is the violence and physical aggression did come up in across all levels of need: emerging, significant, and urgent or crisis. The examples that were given, which we are not going to rehash all of the examples when we go through the next categories, the examples that were given tended to be a lot more significant than threats of harm or some of the physical assault that's listed here. It became, I would say, at a greater level. Go to the next slide. And then this falls under relationship challenges. Family or caregiver relationship stress or conflict. A big one that participants pointed out was that even at the emerging level, they are already seeing that caregivers are burning out. So this might be a parent, this might be a foster parent or a family member, but they're already seeing that their caregivers are burning out, and so they're having challenges with maintaining their child in the home, due to these behaviors. There's targeting siblings. There's a lot of concern about the family relationship already at the emerging level. And then school and home life impact. This is a little bit of a repeat from some of the other things that we've already noticed, but we did ask specifically about what are the school and home life impacts for emerging needs. And case managers or participants noted that family stress and household dynamics, behavioral disruptions at home, emotional and psychological strain at home. And then for school, there's academic challenges, behavioral or emotional concerns at school, and then relationships. And the relationships that they identified that were impacted at school were both with teachers and then also with their peers. Okay, so now we're going to talk about the significant level of need. And in this level of need, um, now we are seeing what participants conveyed to us was that they are seeing more self-harming behaviors and what we're calling risky behaviors emerging at this level. We still see violence and severe aggression, and then also significantly disruptive mental health or developmental disability symptoms. And we're going to give a little bit more example here, as you can see on this slide, for the violence and severe aggression. At this point, case managers reported to us is when they're seeing more property destruction coming up for children. For self-harming behaviors, case managers reported self-harm, suicide ideation, or attempts. And then with risky behaviors, those were really broken down into delinquent behaviors in and of themselves, and then law enforcement contact as well. So with the risky behaviors, case managers reported impulsive decisions, inappropriate internet use, delinquent behaviors were identified as chronic lying, some criminal charges. And then now they were also reporting to us that there's a lot more frequent involvement by law enforcement. So families are calling law enforcement to their home. Calls are coming to the school for law enforcement intervention. And so there's just a lot more frequent involvement by law enforcement at that point. Then again here, school and home life impact for when children are experiencing significant needs. Again, family stress and household dynamics are impacted. There's more behavioral disruptions and concerns at school. And case managers when they were asked about the significant level of need, they reported that at this point, they're already starting to see that there's resource and service exhaustion. And then, like I mentioned before, law enforcement and legal involvement, which could also lead to challenges with accessing services and supports. All right. Then finally here, the urgent level of need. And in our engagement sessions, we went back and forth between calling it urgent or crisis level of need. So when case managers are contacting the state to get assistance for children that they are working with when they're in this situation, typically the child is already out of their home and they might be boarding in a hospital, or they might be in another setting that is not the family home. At this level, it is Specifically, case managers said that they are seeing legal involvement very, very significantly, and then systemic and placement issues are emerging a lot more frequently at this level. Again, here we see the violence and severe aggression, and as I stated before, at this point in the levels of need, case managers were reporting a larger degree of violence that was not manageable in the community at that point, and then the self-harming behaviors as well were consistent at the urgent or crisis level. So for legal involvement, we broke these down into law enforcement contact. Again, that would be coming out to the family home or to the other placement setting that they might be living at the time, and also delinquency charges at that point. So assault charges, property destruction charges, that sort of thing. And then case managers, and Liz will be talking a lot more about the issues that case managers reported in accessing services and placement options for children at this point, but they reported significant placement instability and then inadequate supervision or care if they are placed in settings outside of their family home due to their level of need. And then lastly here, the school and home life impact for urgent needs. Again, with the home, it's family stress, household dynamics, school is behavioral or emotional concerns, and then for the whole system, case managers reported that there were repeated crisis interventions throughout the child's both school and home life. And then I am going to turn this over to Liz now, who's going to be talking more about case management.
Thanks, Ashley. Before I start diving into this section, I just want to pause and ask Kerwin if there's any questions that Ashley or I should verbally address. There may not be, and that's okay.
Hi, Liz. At this point, there are no verbally answerable questions at this point.
All right, thank you. Just as a reminder, if folks do have questions, you can use the Q&A function. We don't have a way to unmute folks to come to ask their question if they raise their hand. All right, so this section is going to dive into participant feedback regarding case management activities for children and youth with complex needs and their families. As a reminder, over half of the participants at our engagement sessions identified themselves as case managers, with over 90% stating they had children and youth with complex needs on their caseload. So this section is going to follow a similar layout that Ashley did, where we're going to talk about case management activities at the emerging level, the significant level, and at the crisis or urgent level. So at the emerging needs level, participants said case managers are utilizing practices such as risk assessments and safety and crisis planning, and their activities include things like needs assessment, proactive planning, and team collaboration and coordination. Participants said these are the top services that case managers are accessing at the emerging needs level. So we were able to categorize them into 4 sections: therapeutic interventions, respite and in-home support services, behavioral support services, and then community and resource access. Within therapeutic interventions, participants identified services such as Children's Therapeutic Services and Supports, or EIDBI, Early Intensive Developmental and Behavioral Interventions, therapy, both family and individual, sort of on an outpatient basis. Within respite and in-home support services, participants identified CDCS, Consumer-Directed Community Supports, Individualized Home Supports, or IHS, and respite. Within the behavioral support services, positive behavior supports, functional behavior assessments, behavioral analysis or a specialist. And then lastly, in the community and resource access, folks listed a whole bunch of things such as family education or DAMI groups. That's the National Association of Mental Illness. Other programs such as through Foster Adopt Minnesota, also known as FAM, or Lutheran Social Services Kinship Services. And then lastly, participants also identified extracurricular activities that were preferred by the child or youth, and usually those that had some physical component to them. Then the top service access barrier that participants identified at the emerging needs level was provider availability. And the next few slides provide quotes from participants about this. So I am just going to read some of those for you. These are direct quotes from participants. So a definite issue with availability of services, offering respite care, but no providers are able to be found. No providers available or long wait lists. I would offer IHS, but our providers are full with wait lists. MA services like EIDBI are also full. All right, now we're at the significant needs level. So participants said case managers utilize practices such as risk assessments and safety and crisis planning, which again, we saw at the emerging need, but also crisis resources and non-residential services, and that case managers were starting to seek residential placement options. Participants said at the significant needs level, case managers are utilizing the same activities as at the emerging level, but would include increased communication at this point. And the barriers and challenges that participants said case managers experienced at this level include limited resources. At the significantly needs level, participants said the top services accessed fell into these categories: crisis management and prevention, hospital access, and treatment and residential placement. So within crisis management and prevention, participants identified specific examples such as MCCP, or the Metro Crisis Coordination Program, crisis respite, and community support services, which is a Minnesota state operated direct care and treatment crisis intervention program. Participants also identified hospitalization in general or boarding in emergency rooms. And then within the treatment and residential placements, examples were given such as PRTFs, so utilizing psychiatric residential treatment facilities, group homes, residential placements, as well as voluntary placements. The top service access barrier that participants identified for the significant needs level was provider availability and accessibility challenges. As with the emerging needs level, the next few slides provide direct quotes from participants that talk more about this. So participants were quoted as saying, "We don't have resources available. Mental health resources are extremely limited or not available for DD children," and DD stands for developmentally disabled. "It's very difficult to get services started quick enough to address significant behaviors. Often by the time you find a provider who can support the child has already been hospitalized, etc. Seeking wherever the child will be accepted, as there are typically few." All right, and then lastly, at the urgent or crisis needs level, participants said case managers utilize residential placements for crisis response practices, and that case managers are utilizing the same activities as those at the emerging and significant levels, which we've already talked about. The barriers and challenges at the urgent level have grown to include systemic challenges, limited resources, placement barriers, and case manager burnout and emotional strain. We've bolded the case manager burnout and emotional strain as this was a frequent response from participants at this urgent or crisis level of needs. At the urgent needs level, participants said these are the top services that are being accessed by case managers. So they are accessing emergency shelter beds, crisis respite, or paying for 2-to-1 staffing in shelter type settings. Participants also said case managers are using hospitals, and again, placement in psychiatric residential treatment facilities. The top service access barrier that participants identified at the urgent needs level was again provider availability. And I'm going to read some quotes that speak more to this. Leaving them in their current home setting with parents waiting out wait lists, them referring to the child or youth with complex needs. Very limited options. The ER ends up being our only option. Typically, I have only found in law enforcement and the ER, sad face. Truly no options locally outside of hospitalization. At this level, it's usually hospitalization or juvenile detention, not the best options. Then one of the last questions that participants were asked during our engagement sessions was, what do you think is your region's biggest need to effectively serve children and youth and their families with complex needs? And participants said local and accessible services was the biggest need, which involved the need for more qualified service providers, an increase in placement availability, and more in-home services. We did not receive a ton of specifics on those, so we are interpreting that those are across the spectrum. So in-home service providers, community-based providers, treatment providers, family services, sort of all of the above. And then we also wanted to highlight that during our engagement sessions, the Central and Southwest regions identified transportation to and from services was highlighted as their biggest needs. And so we wanted to call that out as we had several folks in the Central and Southwest regions who came off mute and provided some really helpful information related to that. All right, I'm going to pause here and make sure there's no questions.
Hi, Liz. We did have a question come in. There was a question asked. It is, will this presentation evolve into discussions and information about resources and recommendations that DHS is working on to help resolve some of the barriers that are being encountered from case managers?
Yeah, that's a great question. Thank you, Kerwin. So one of the things I'm actually going to discuss sort of in this next section is a resource document that we put together based on resources that participants provided to us. The other thing I wanted to mention is following this webinar, we're sort of entering into phase 2 of this work. So sort of the basis of why we wanted to do this is to really understand from a policy and practice perspective, what could DCYF and DHS do together to move the dial for counties and tribes who are serving children and youth and their families with complex needs. So we'll be honest, phase 2, we don't have a whole lot of a plan right now. We're focusing on making it through the 6 engagement sessions and then providing this webinar. And then DCYF also in conjunction with DHS is providing sort of a series of webinars through October, which also, those topics also kind of came out of the feedback that we got in these engagement sessions. But our plan is to continue the discussion regionally so that, again, DCYF and DHS can support efforts to move the dial from a policy and practice perspective on this issue of children and youth with complex needs. Ashley, if there's anything you want to add to that, please do so.
Yeah, I think you covered it all very well, Liz. The one thing I would add is that we have shared this information with our colleagues, and there are several of our colleagues here from DHS as well, listening to this presentation. So I know that there are broader efforts underway across both DCYF and the Department of Human Services, but we are not in a position to be able to speak to those specific efforts in this presentation. What Liz is going to be talking about the collaboration aspect, however, and as far as recommendations go, that's one of Liz and that's one of our recommendations, is that case managers collaborate with each other. But from a systems perspective, we're not in a position to be able to speak on the broader efforts of the department in this space.
All right. Now we're going to move into this section, like I talked about a little bit before, which includes participant feedback regarding case manager collaboration, barriers, and successful strategies. So participants identified these categories for case managers' barriers to collaboration with family and relatives. We have relational and emotional barriers, which included family and relatives' mistrust of the system, their burnout or exhaustion, and family resistance and conflict. We have resource and practical barriers, so that included time and scheduling challenges, limited access to services or supports, and lack of financial resources. And then lastly, systemic and structural barriers, which some examples of those were system navigation complexity, which caused confusion, overwhelming paperwork and referral processes, and then wait lists leading to frustration, fatigue, and burnout. Participants provided successful strategies case managers utilize for collaboration with family and relatives, and we categorized these into 4 areas: building trust and relationships, inclusive and empowering family engagement, flexible and accessible collaboration practices, and providing additional support and resources. Some of the examples that participants gave for building trust and relationships included showing commitment through actions, consistency and transparency, and meeting relatives where they are at. For the inclusive and empowering family engagement, participants gave examples of shared goals and responsibilities, meetings that included everyone that the family wants to be involved, such as friends or neighbors, and directly asking all family for input and opinions. In the flexible and accessible collaboration practices, participants gave examples such as meeting with family at the same time as other case managers are meeting with family, flexibility with days, times, and locations of those meetings, and using preferred communication methods of the family, so text, emails, phone, in person. And then lastly, with the providing additional support and resources, participants identified gas vouchers, paying extended family members for respite, and assisting with transportation as examples there. Participants also provided many collaboration tools, and some of those are listed here. This slide deck will be posted along with this webinar recording, so you'll be able to access the slide deck, and these are all clickable links that you will be able to utilize. So just to name a few, participants talked about the family group decision-making model and process is a great collaboration tool with family and relatives, person-centered planning, motivational interviewing, signs of safety principles, comfort calls, and the restorative justice model. And again, once the slide deck is available, you will be able to click on those and learn more about them if you're not familiar with them. So in addition to barriers to collaboration that case managers had with family and relatives, participants also identified barriers case managers experience collaborating with one another or at the interagency level. And so those included systemic or organizational limitations, which participants gave examples such as lack of policy or procedures to facilitate collaboration. Resource challenges, and some examples participants said for that was limited staffing or staffing turnover. And then participants also identified specific barriers that contracted case managers experience, such as data sharing and the lack of county-based service access and knowledge. In addition to barriers, participants identified successful strategies for collaboration between case managers and at the interagency level. They identified those as internal support for collaboration. So agencies had agency-wide policies, procedures, and protocols to facilitate and require collaboration between case managers. So for example, a child welfare case manager, a children's mental health case manager, and a waiver case manager following those policies, procedures, and protocols to facilitate their collaboration on a case that they're all working on together. Some other ones that were identified, structured meetings and case consultations. So scheduled collaboration across social service departments was given as an example for that. And then lastly, informal communication and technology use. Participants said when there were collaborative documents that eliminate duplication, and when there was quick reference guides that families could utilize to identify case management roles, that was also a successful strategy. During our regional engagement sessions, participants provided a plethora of information related to collaboration barriers and successful strategies, both with family and relatives and with them within case managers on the interagency level. And it was so much information and feedback they provided, we couldn't fit it all on to these slides. So we created a resource document that dives deeper into the participants' feedback. This resource document will be posted alongside this webinar recording and the slide deck. And as Ashley mentioned, you'll be able to access all of those in the coming weeks on the webpage where you registered for this webinar. And so again, this resource document is outlining all of the feedback that participants gave related to case management barriers and strategies, successful strategies, excuse me, for collaborating with family and relatives, with case managers in their agency and sort of at the interagency level. We are way ahead of time here. So as we begin to wrap up, we wanted to end with some powerful word clouds that were created from participants' feedback during our 6 engagement sessions. So if you're not familiar, a word cloud, the larger the word, the more often it was a response by participants. So this word cloud includes strengths of family and relatives. And as you can see, the words used most frequently were advocate, resourceful, love, committed, and determined. And we found this word cloud to be very powerful. We have one more. And this word cloud was related to the strengths of children and youth with complex needs. And the words used most frequently to describe the strengths were resilient, determined, adaptable, and advocate. All right. So before we jump into the resources section here, I'm going to do another pause and see if there's any questions that we need to address.
I do not see any questions. There is a comment, it seems like, for things to consider. We'll make sure that we add that to our document moving forward.
Thank you so much. Yeah, if you please use the Q&A, not just for questions, but if you have comments, we'd love to have them as well.
Absolutely. Yes. Thank you so much. Well, so we're going to go through some resources that we thought might be helpful for you in your work with children with complex needs. Some of these resources you can share with family, and some resources are for case managers as you are doing your work with families and children with complex needs. All of these are hyperlinked. So again, once we post this, you will be able to access all of these resources. And I'm just going to highlight a few on each of these slides. So for this resource page, I wanted to highlight specifically first Foster Adopt Minnesota and NAMI Minnesota both have parent support groups and caregiver support groups. Foster Adopt Minnesota, even though it has the term adopt in its title, it is a resource also for parents and for foster parents. And so that is a great resource with not just support groups, but also with a plethora of other service navigational tools that they can assist with. The Adoption Medicine Clinic offers specific services for parents and for families who have adopted a child, and to get assessment services, and then some specific treatment services for children that have experienced adoption. And then Disability Hub is one of my favorite resources to give out to folks. It is useful not just for families, but also for case managers in understanding what types of disability services are available, but also understanding the eligibility process for it. So that is an excellent resource as well. And then there's other resources on there as well that you can look at. So ombudsperson is someone who investigates, reports on, and helps settle complaints, often involving government agencies. And so as folks that work with families and with children, you can also access these offices for assistance, and you can provide these offices as resources to the families that you are working with, particularly if they're in need of advocacy assistance. So these were all of the ones that we thought would be the most applicable to this work. Now, child welfare resources for case managers. The next two resource slides we kind of broke up into child welfare and then other services, so children's mental health and disability services, and then general resources for case managers. So the first three links on here are links to various parts of our webpage for child foster care. The foster care community of practice is a regular meeting that provides a space for case managers across all service areas. So doesn't matter if you are a waiver case manager or a children's mental health case manager, you are welcome to come and invited to come. And it's a space for you to learn more about specific child welfare policy and practice related to when a child is in out-of-home placement. So for example, one of the ones they did recently was on relative engagement. The rest of the links on this page are links to practice guides and info sheets on policy requirements for when a child is placed in foster care or is no longer in their home. So again, even though this says this is child welfare resources for case managers, these are resources for all of you, regardless of if you are working in child welfare, child protection, or in waiver or children's mental health or a contracted case management position. If you have a child who is in out-of-home placement, these resources are for you. And the same goes for this one, even though this says Children's Mental Health and Disability Services resources for case managers, child welfare, child protection, and adoption guardianship workers, these resources are also for you to learn about what your colleagues do and what services they have access to, and also about some eligibility processes that are in place. So the first one is specifically children's mental health policies and procedures, and then the rest are a whole variety of tools that have been put together for case managers who are working in the disability service line. So again, this is for all of you to learn more about what services are available across the spectrum. All right, so again, as we mentioned at the very beginning, all of our work here was born out of case managers contacting our different departments across the state to get assistance in service access. So here is a page dealing just with looking at service access. First, we have the Disability Services Division contact form. This is the #1 way to get in touch with anyone in our Disability Services Division. If you have questions on policy, if you have questions on practice or service access for disability waiver or anything in between, if it has to do with disability services, that is the way to contact them. We have a new team in our Behavioral Health Administration, the Intensive Residential Transitions Program, and they can assist if you are having a child on your caseload who is in a residential program or such as a PRTF or a children's residential facility, and you are needing assistance with transitioning them over into their next phase, hopefully back home. You can contact these folks in Behavioral Health Administration through this. This is a link to an eDoc that explains more about their program, and they can give you some assistance, technical assistance on that, on different services that you can access. Also, we have a link here to our complex transitions team. I mentioned them at the very beginning of our webinar here. They are in our Aging and Disability Services Administration, and they are specifically there to assist case managers who have children that are boarding in hospitals or in other institutional settings, helping folks to navigate the service system and be able to figure out what eligibility they need to get through in order to get services in place. The Permanency Hub of Minnesota is another excellent resource for any, if you are serving a child who has been adopted or has a guardian, this is an excellent resource for you for post-permanency supports and other types of supportive services that might be available for the parents of that child, the family of that child, and for the child themselves. And then the last one that I'm going to touch on here is licensing information lookup. When you are looking for, in particular, a residential placement for a child, it is critical that you look on licensing information lookup. to identify what kind of a program it is. So this is a link to licensing information lookup, and you can sort the programs by their license type. And that will be very helpful for you in determining if the program is going to meet your child's needs. And I think that is it.
So before I check to see if there is questions, I do want to do a little bit of a shameless plug here for our upcoming webinars. So June through October, the Department of Children, Youth, and Families, oftentimes in conjunction with the Department of Human Services, is offering a series of webinars related to navigating complex and residential placements. And so our June series partnered with SSIS and their SSIS Coffee Talk to talk about placement entries. Then Ashley and I just hosted here your July webinar. In August, Ashley and I will be providing a voluntary placement agreement for treatment webinar. September includes a qualified residential treatment program placements and requirements webinar. And then we will round out the series in October, where Ashley and I again will be presenting on the residential placements overview. And as we previously mentioned, the idea behind this series around navigating complex and residential placements grew out of feedback that we received in these engagement sessions. So this is sort of part of phase one, and will also allow us to start to develop and plan for phase two, whatever that might look like. You can find the webinar series on the same webpage that you use to register for this webinar. And as the webinars are completed, then the recordings and the slide decks will all be housed there for easy access by folks.
Can I just jump in real quick, Liz? The residential placement overview webinar that Liz mentioned that we're doing in October, we are doing that in conjunction with our Behavioral Health Administration and with our Disability Services Administration as well, because the different types of residential placements cross into those policy areas.
All right, I'm going to do one last check with Kerwin. I think there's no questions, but I'm just going to double check.
You are correct. There are no more additional questions at this time.
All right. That concludes our webinar, way ahead of schedule. Ashley and I might have thought of ourselves as a little to need 2 hours maybe for this. So, but we thank you all for joining. And as we've mentioned, please look for the recording and the PowerPoint slides and a resource document in the coming weeks here.
Thank you.